Hello and welcome to What the Tech from Boast AI, where we talk with some of the brilliant minds behind new and exciting tech initiatives to learn what it takes to tackle technological uncertainty and eventually change the world. I'm Paul Davenport, Boast resident tech journalist. Today I'm thrilled to welcome to the show Sabina Bruehlmann, CEO at Nimble Science. Sabina has a wealth of expertise turning promising technologies into life-changing products in viable companies. This includes spending more than 2 decades developing and managing mature IP strategies, obtaining regulatory clearances for novel products, establishing workable quality systems, innovating and managing successful R&D programs, raising funds, and everything around and in between. At Nimble Science, Sabina and her team offer a multi-omic data platform to advance healthcare innovation. This includes developing the SIMBA Capsule, a clinically validated ingestible device that enables unparalleled access to the microenvironment of the small intestine. I'm going to probably ask Sabina for a clarification on the pronunciation there, but needless to say, this is a truly revolutionary innovation that holds the promise of unlocking new possibilities for diagnostics, therapeutics, and beyond. So, along with driving innovation with a global impact, Sabina is also a member of the Calgary tech community, who we are thrilled to partner with here at Boast. But it's an incredible journey, and I'm thrilled to pick Sabina's brain on her path through the health innovation ecosystem and what's next for Nimble Science in 2026. So, without further ado, welcome to the show, Sabina.
That's an awesome intro. I'm gonna listen to that again. That was great. Thank you.
Absolutely. Oh, I always love to butter up the guests a little bit before they hop on, but genuinely excited. I have a lot of questions that we could go deep on. But before we go into the deep end, I'd love to just hear from you in your words, not mine. Who is Sabina? How'd you get into this space? What sparked your curiosity and got you into driving healthcare innovation?
Oh my God, that's a big question. Okay, so I became a mechanical engineer. This is a story I tell all the time. So I became a mechanical engineer because I got a free computer to go into that program because that was like in the mid 90s when they were encouraging women to go into engineering. I became a mechanical engineer because I could draw really straight lines. All of those were really thought through decisions that I was really just following my gut. I was very fortunate to land at a biomedical institute where I then figured out the interesting part of engineering for me, which was engineering the body, which, if you think about it, little short plug for biomedical engineers out there, it is the ultimate engineering because you have to reverse engineer one of the most complex machines on the planet, understand it first, and then try to address it. So to me, it's the ultimate in engineering. After my PhD, I ran into a VC in the hallway and it all started from there.
That is amazing. I love how you phrase that too. Most complex machines on the planet. And that's really, again, I feel like that's unsung, especially with AI, everything. Humans are the complicated machine.
Yeah, AI is nothing to the complexity of the human body. I mean, it is, and there are layers that we just don't like. We don't even begin to understand how the body works. It's really fascinating.
It really is. I didn't mention this previously, but I'm actually based down here in Boston, Massachusetts. So we are a biotech hub. And I'm pretty sure half my street are, if not medical engineers, doctors of some stripe or medical professionals of some stripe. So I just want to draw a fine line under that. This is the real hard engineering work, and it's the stuff that actually truly makes that world-changing innovation come to life. So just want to back you up on that point.
Ultimately, it all comes down to, I mean, our health really is everything. So it is the be all and end all.
Oh, I love it. All right. So, Nimble Science specifically, we know a bit more about Sabina, but I want to know about what you guys are doing there. I gave a very, very quick primer at the top and even referenced some of the new technology that you've developed. But if you could go into a little more detail for our audience, what are you guys doing at Nimble Science? What makes it so unique and what's really groundbreaking about the technology
Yeah,
there?
I've got a great way to explain this. So small intestine is, I mean, we all know about the small intestine. I mean, we don't think about it a lot, but we know that that's where our body digests food, our body absorbs drugs. It's where our immunity is controlled. It's not in our butt. It's not in our colon. The colon has mostly the colon's job is to pull water out. And and some fermentation of a few things, but really the control center of everything we put in our mouth and that we hope influences our body goes through the small intestine. Small intestine is completely out of reach. So even when you go from the top with a scope or from the bottom with a scope, you're not getting into the what I call the control center, that distal small intestine, which is your ileum jejunum region. And so it really is the black box of our body. And using proxy methods like urine and blood and symptom recording and fecal matter, we learn a lot about gut microbiome and what it's doing. We understand that it's more than our guts, that it's our brain health and our cardiac health, and even the way our oncology drugs are reacting. We know it's this massive control center, and we're totally locked out of it. So, the first thing Nimble does is we create a capsule to get at that fluid. So, think of that as your rocket ship and the small intestine as the dark side of the moon. Everybody wants to go to the dark side of the moon. The dark side of the moon is cool, right? So you build a rocket ship and you bring everyone to the dark side of the moon, and they're like, this is amazing. And then you realize bringing people to the dark side of the moon is not helpful when people don't know what they're looking at and what's there. So that's where the data platform, where Nimble has not just the rocket ship to get you to the area of interest, but a way of interpreting and understanding what you're seeing. And that's this complex multi-omic data platform that we have. And we work with companies to help them interpret and understand what's going on in the small intestine in relation to their products. And then we work on the clinical side to help clinicians understand what's happening in the small intestine in relation to their patients. So it's a two-sided coin. We take the learnings that we get from working and supporting the companies, and we bring that over to the clinical side. We take the data we get from the clinical side and we bring it over to support the companies. It's the typical flywheel with a rocket ship in the middle.
Love it. Okay, so a few things came to mind while you were explaining that I'm just going to call back on. First off, my mind went to the magic school bus. I'm thinking about them shrinking down Miss Frizzle going through the intestine. I think everyone in my age group is probably picturing exactly that meme inside the body where it's going down there. So your rocket ship to the dark side of the moon, in my mind, I'm like, oh, it's Miss Frizzle getting down to the bottom and actually investigating what's in there and getting that information. Another thing too, which again, it's not in the butt. I am my partner is looking
The
into becoming
gut is not the butt. Let's make that
exactly.
tagline, all right? The gut
Title of
is
episode,
not
that is not
the
the butt.
butt.
I literally just learned this weekend. He told me the same thing. He's like, the large intestine and the colon, that's just for like water absorption for the most part. He's like, that's not where the stuff is happening. And
Yeah.
I think that was a misconception I had. I never really delineated from how it all worked. I'm just like, oh, it's just tubes from the top down, right?
Yeah, it's like a
Not at all.
tube. You drop it in and it comes out. No. And
Exactly.
we look at this. So when you look at the data from the small intestine, it is sometimes a near complete mirror image of what happens in the fecal matter. So when you think of all this work that we do to study fecal matter, it's literally the garbage for the party that happened upstairs and you weren't invited at. And you can't tell what was going on at the party from the garbage. I mean, there's some, you can kind of tell a little bit, right? But it's not the same like being on that magic school bus and getting into the grid of it.
I love that. Can't tell from the garbage what happened at the party.
Can't tell from the garbage what's happening at the party.
All right. Now, I want to also pull on that flywheel, that two sides, where you guys are that rocket ship, but you work with companies and you work with clinicians. Now, you did explain, but I'd love to go even deeper. What are some of the companies specifically that you're working with? Obviously in the medical space, but are there any examples or even just like really cool companies you want to shout out that, again, have benefited
Yeah,
from having you as
it's
this
you know
rocket
what?
ship?
The surprising thing is it's not just in the medical space.
Really?
We're a very medical focused company, but actually it's food and nutrition companies that were knocking at our door going, let us in, give us access to this. So it's companies like Fonterra, the world's largest dairy producers,
Mhm.
Nestle, nutraceutical companies, chocolate companies, bread companies, biopharma companies, of course, and those developing biologics. But the food companies understand. Listen, food companies, the whole food is medicine. Food companies, they want to do good. They have massive R&D programs that are really focused on gut health. The problem is they don't have any information to figure out really what their food is doing in the gut because it happens in the small intestine. So the food and nutrition industry was right on top of this. They understand that food as medicine is a possibility, but to be food as medicine, you need to understand what's actually, and that's the whole thing that makes medicine medicine is we understand what it's doing and how it's doing it. So helping those food companies understand what their products are doing is how food as medicine is going to become a reality. And then on the flip side, having tests so that the individuals can understand what they need and pairing that with the right food I think really opens up a whole new paradigm for how we think about GI health and how we treat it.
Okay, yeah, I don't know why I wasn't expecting you to say food and nutrition companies, but that makes perfect sense. Like you said, it's a
Like,
black box. You're giving them access to all the good data that's
yeah.
happening in.
And then on the pharma side, I mean, are the drugs that we take, the oral drugs that we take, they either have deleterious effects like an oral dosing of chemo. How much dosing do you put down there? And what effect is it having to know what's actually happening in the site of interest? Or how much is being metabolized? Or even more importantly, like what types of microbes are affecting the dosing effect of how much metabolism you're getting? So, can you get your Parkinson's levodopa dosing to be much more effective if you take care of certain microbes in your gut? So, the pharma industry has a really big opportunity here as well to make more effective drugs and more effective treatment programs with their patients.
Yeah, and I'm not sure if this is a current use case, but you actually just hit the nail on the head. Helping individuals, helping actual patients, because we're all built differently. That's again why we're such complex machines. We're not all built exactly the same way. We don't have the same lived experiences. So I'm mad. And again, to your point about like the biopharma and like the pills we're taking and the treatments we're taking, it's not going to necessarily work the same one to one. Is this a way for folks to really, which I think you just explained a little bit, tailor their treatment
Totally.
and just can really help?
Yeah, I mean, even the simplest use case, let's talk about like antibiotics. So you get prescribed an antibiotic for your IBS. That antibiotic, I think, has around a 44% chance of working for you. Why? Because they don't know whether your IBS is a microbial feature that is needs an antibiotic. They don't know if it's a pathogenic response. They don't know if that pathogen or pathobiont is resistant to antimicrobials. So they just have to throw something down the hatch and hope for the best. And a lot of clinicians are really hesitant. They know that it's not great to give antibiotics if they're not needed, and they know that on a population scale and on an individual scale. So getting in there and being like, "Look, this is what's happening in your small intestine. These are the targets. Let's hit them." It's game changing, and it doesn't have to be more complicated than even the antimicrobial story, which is pretty basic. But then you can get into much more complex drugs that have mechanisms of action that rely on or are altered by the microbiome within the small intestine. So we got to stop thinking about microbiome as butt material. It's much more complex, and it's resident within your small intestine, and you can't tell what it looks like from your fecal matter.
The wheels are turning here. I'm thinking of even more
It's
use
game
cases.
changing. It's a
It's
paradigm
so
shift.
game
It really is
changing. Yeah.
it's a paradigm shift. And I think it's a paradigm. Listen, what our vision right now is gut health has become almost the default responsibility of the individual,
Mhm.
because the clinicians don't really have the tools to participate in that discussion. So individuals go off to largely consumer-based companies to get these consumer type tests, and then they bring them to their doctor and they want to participate. They want the doctor to participate in that conversation, and the doctor doesn't really know what to do with that information. And it's because it's not from a relevant part of the body for the doctor's understanding of what's actually happening in your indication. So getting a test in the hands of a patient that they can bring to a clinician and the clinician can responsibly participate in that therapeutic course of action is where we feel like our niche is. It's clinically elevated gastrointestinal information.
Again, game changing. I know I say that a lot on this podcast. You probably see a lot in my content too. I use and abuse some drugs.
Well, you find the game change. There's a lot of ways to change the game. The world can be nimble, for example.
Absolutely. We're agile right now. Look at us. We're talking across
Yeah.
borders and we're making it happen without even being in person right now. So yeah, I agree. Dragon works sometimes. Actually, on that note too, I know that you were talking about how you were talking yesterday, doing a lot of pitching. And again, you've been doing this for a long time and you've built other businesses and you've helped, as I mentioned, even get that funding and even help get businesses off the ground. Tell me a little bit about how that has changed over the course of your career. Like, what's different in 2026 when it comes to whether it's pitching to VCs or whether it's actually trying to tackle non-dilutive funding or get any kind of investment to actually build the business versus maybe 5 years ago or even longer back?
Yeah, let's go. I mean, longer back, it wasn't really a responsibility that I held. When I was at the last startup company, I was really responsible for developing the product and other things. But I mean, the whole ecosystem has shifted, right? The world understands the role that entrepreneur play, particularly in the med tech and different tech spaces. I think the ecosystem is so much richer. I mean, I'm speaking about in Canada in particular, right? That's the zone that I know. We've got phenomenal ecosystem supports to help companies like ours get off the ground. and then the VCs understand sort of where they play in that space and how they can leverage those pieces. I don't think it's really changed as much as it's been. Yeah, I don't know that it's changed. I think the story. I think it's gotten a little bit bigger, a little more intense. But I mean, I think, and you have asked 75 years ago, they'd say the same thing. Like, when is somebody like, oh yeah, it's super not intense. I just call people up and they give me money. I mean, they talk about, oh, years ago it was that easy. It was never that easy, right?
Sure.
You always had to have a good story and you had to deliver. So yeah, I don't see any big changes. I think the ecosystems that we're building in Canada are amazing. In Calgary, in particular, we're very fortunate to have the ecosystem supports.
I think you actually hit the nail on the head with something you just said there. You have to have a good story, and I think that's evergreen, regardless of whether it was, like you said, 75 years ago or even today. I think
Yeah.
obviously there's a lot more noise, and a lot more people think that they're telling a good story. Not to bash AI, I can't at all. We love it. We have to use it here at Boast, but I also want to call back to your point about the ecosystem too, and how it's just more expansive. I feel like I've only really been operating in the Canadian market for about the past 4 or 5 years, and just businesses like Nimble, businesses like, I'm trying to think of some of the other innovators, even just in Calgary, like not in the med tech space, but like VisWorks. They're just developing things that I don't think there were necessarily resources like that at this scale that they are today. I just feel like everything's getting a little more expansive in terms of the support and the ecosystem that you have there.
I mean, you can do so much more, right? Like the types of programs that you have available to you on, just like the way the QuickBooks operates, the way the QuickBooks interacts with, right? All these sort of AI enabled tools allows you as small founding groups to really do a lot by leveraging different tools, and you can replace a lot of different people. And we talk a lot about AI replacing people. Well, in the small startup world, you're not replacing people, you're creating capacity that you otherwise wouldn't have had those people anyway, right? So the capacity to create and build a company and scale globally, like Nimble works on all four continents. We have, 30 partnerships with companies around the world. How do we do that? Well, because we can do it all from our computer. We meet, so I think that the capacity to build big is really different in the last 5 years.
I love it. You're actually reminding me of a conversation I had with Anuj Rastogi from Backstretch. It's actually the podcast that dropped as we're recording today. And he
Okay.
was talking about how, like, the unit economics. So he's kind of on the staffing side of things. And he had a very similar message where you said, like, it's creating the capacity to scale. It's exactly the message that he was pushing off. He's like, sure, a business might not have, someone with a great idea might not have had the ability to get all the talent that they needed a few years ago. They need fewer individuals now just because, like you said, it created the capacity to scale with AI and more tools. So, yeah, there's not necessarily so much replacement, but the skill sets, you can just do more. You get the
The
superpowers now
problem
too.
is in the text building space, I think your mental bandwidth is your greatest asset, right? And so if you're building strategically, you need the space to think strategically. And sometimes these tools let you believe like, oh, I can be the accountant and I can be the marketer and I can be but then you're not really taking account of all the ways that your brain is shifting during a day because you can be all those things. And I think that can be at the detriment of the company. And so being careful not to be all those things just because they're another program on your computer, and leveraging expertise of someone that actually knows marketing and that is in that headspace and actually knows the CFO role and is in that headspace. There's a lot of value in that. So I think we're going to have to come back and be like, okay, we can do all these things, but people actually still matter. People with their experience and the way that they approach things, their perspectives,
Yeah.
is the flip side of it.
Completely. I'm like, actually, two thoughts on that one. The first one, going back to my conversation with Anuj, because it's top of mind too. He emphasizes too that AI can hear, but humans can listen. And that's also going to be a skill that I think we're going to see more ebbs and flows as that becomes truer, or at least more evident in practice, as people are deploying these tools and developing new businesses. But the second point I want to call back on was your point about, like, not dissecting your focus because you have tools that might make you think you can do that when you're just gonna be burning you out. The CFO needs to focus on the finance side of the house. Sure, they're going to touch the CTO pool a little bit, but to your other point too, marketing needs to stay in marketing. I gotta give Boast a little shout out here because that's kind of at the crux of our message too, is that listen, you're focused on innovation, you're focused on R&D. You might not even know about R&D tax credits, but your R&D team shouldn't be pulled into conversations about getting funding necessarily. If that's a skill of theirs, absolutely go for it. If they can tell that story, and you're going to still need to do like those technical interviews to make sure that you're getting the funding that you want, but what we really preach is find a partner who can really support you without stretching your resources in every way, not just costs, in expertise, in terms of your actual time and your bandwidth. If your R&D team is working on claiming tax credits, they're not actually doing the R&D that would get them tax credits. So just need to give that call out there. It's my more cynical Boast push here, but I just had to do it. You dropped
No, you're right.
perfect hook
You're
for me.
absolutely right.
Yeah.
Yep. And leaving money on the table is one of the silliest things you can do.
Absolutely. Yeah. So enough about Boast. Now I want to know what's next for Nimble Science in 2026 as things are ramping up.
So the big push is we're flipping our focus from the B2B side, which is a nice sort of scaling business of ours, over onto the clinical. We're ready to launch the first small intestinal aspirate test to the clinic. So individuals will be able to assess their small intestinal performance as it relates to, the way that it's absorbing vitamins, the way that it's producing different, gas symptoms associated with bloating, pathogens. So it's going to be the first. We're going to launch it here in Alberta. We're going to scale it across Canada as sort of a global soft launch. And it's going to be a full paradigm shift in the way that individuals can work with their clinicians on presenting real data about that relates to how they feel. And so that's going to be a big mid 2026 launch.
That is exciting. So again, all the things that we were talking about here, even those abstract in my mind use cases, they're happening. It's going to be out there. Excited for Alberta to get the first chomp at it too. But Sabina, this has been a total pleasure.
Yeah, it's great to have the opportunity to talk about it. I think this is the first time we've talked about our formal clinical launch. So there you go. It's been announced here. Yeah. So thanks
I
very much.
love it. Thank you so much, Sabina. Well, again, thank you for joining us on the show. Got to shout out Tech Thursday also for connecting us. We're big fans of theirs. I'm actually going to be going up to Calgary in early April. So if by some means we can cross paths, I'd love to say hi in person or at least just
Yeah, you
high
can
five
come
and
and
get one of
swallow
the
a
great
pill and
work.
give us your sample and
Love it.
build solutions.
I'm your guinea
Thank
pig.
you.
I love it. Thanks again, Sabina. Awesome.
Thanks.